Welcome back to the Summit Independent Insurance Podcast. We're here with money-saving tips and strategies to optimize your healthcare. Today, I'm here with Summit's owner and founder, Tim Coughlin. And today, we're going to be talking about possible double-digit rate increases in Medicare supplements. Now, this would include plans like the Plan F, the Plan G, and the Plan N. Tim, do you really think that's possible that we'll see rate increases that large?
Unfortunately, I do, Jack. I haven't gotten any notifications from major carriers yet, but in the research I'm doing and running it through Perplexity AI, which is a great research tool if people want to check that out, there are a number of factors that could be leading to higher than average rate increases on those popular plans like Plan F, Plan G, and Plan N in 2025. I'm here in Northern California, and of course, there's going to be considerable variation among the different regions here. Northern California would encompass everything from the San Francisco Bay Area and Peninsula, the North Bay, all the way up to Eureka, over to Redding, Fresno area, at Lake Tahoe, the foothills, the Gold Country, and of course the Sacramento region where I am. So we're anticipating considerable variability among the regions, anywhere from 3 to 12%, depending on the region and the plan chosen. Let me just say I'm very casual today. I just got back from the gym. I've really been trying to keep my heart healthy and doing a lot of HIIT workouts, high intensity workouts on the self-powered treadmill and get my heart rate up. Forgive me for being casual this morning, but I wanted to be here because it's important. It's money. We've all been hit with inflation over the last couple years and increasing costs and in a number of areas. Trying to optimize your health care and save money on your Medicare supplements, also known as Medigap premiums, I think is pretty important. So I wanted to sit down with you, Jack, for this important podcast.
Yeah, thank you for doing that. And I will say, of course, the exercise is extremely important, and that's the front line of protecting yourself. And I know you encourage all your clients to lead as healthy as a lifestyle as possible. And so I certainly don't think anyone will mind that. But I did want to ask you, so when we talk about Medicare Supplement or Medigap, as some people say, plans, there's really the main plans are Plan F, the Plan G, and the Plan N. Now, with these increases, I know that you mentioned that based on the location, there's going to be a variance in the percentage of increase. Do you think that there will be a variance based on the letter plan? And if so, go into maybe a little bit as to why one of those will be increasing more than the other.
Yeah, I think that's really important. So, Plan F, as people may know, is no longer being offered to people that are turning 65 unless they were eligible for Medicare before January 1st, 2020. So, Plan F is really not being sold very much. We still have quite a few clients that haven't given up their Plan F yet because they love the benefits. And if they can afford it, it's really complete coverage. It plugs up all the gaps in Medicare's medical coverage. So it's a kind of a Cadillac plan. But because the younger people that are turning 65 now can no longer get into the Plan F, people have anticipated that Plan F rates will go up faster as more and more older people with more health conditions stay on the Plan F and younger, healthier people come into the Plan G or the Plan N.
Right.
Now, there is some variation among carriers with that. For example, we have one carrier that has really amazing Plan F rates. I would say another factor is if you're on an old closed Plan F, with some of the carriers have closed blocks of business, those rates can be way out of line
Yeah.
with what's available in the marketplace. And of course, in California, we have the California birthday rule, which allows individuals to move to an equal or lesser Medicare supplement plan if they already have an existing plan without any health questions every year around their birthday. So there's really no reason for someone who's overpaying for a plan to continue to overpay. I would say that we have seen higher rate increases on the Plan F. And for our clients, we have about 2,000 Medicare supplement clients. We have moved most of those to the G or the N. But again, there are people who don't want to give up their F. And even if we try to educate them that you're really not giving up a lot to go to a G or an N, they're happy with their plan and they can afford it. And that's fine. We are possibly also considering rate increases on the Plan G. The Plan G, when it took over for the Plan F, we are getting the younger, newer people. That's the most popular plan by far, but it's also what we call a guarantee issue plan. So anybody who may have significant health issues that does have a guaranteed issue opportunity is generally now going into the Plan G. And the same principle that applies to the F applies to the G. You're getting some older people with more pre-existing conditions that are happy with the G. Of course, on the G, the only difference between the G and the F is that the G does not pay the Part B deductible, the medical insurance or outpatient deductible, which for 2025 is $257. So if you can save $500 or $600 moving from F to G, it's a no-brainer because you're saving way more than that $257 Part B deductible, which is the only difference between F and G. So I'm curious to see how the Plan G rates compare this year, what those rate increases look like, and also in comparison to Plan N.
Yeah, so if somebody gets a rate increase, and we're talking about California right now, if somebody gets a rate increase in the mail, something that they're not comfortable with, you should probably check with your agent the other options that you have. And if you are okay with answering health questions, you can switch at any point. But if you're within your birthday rule, then you can go ahead and look at options to switch without answering health questions.
Yeah, absolutely. There's no reason to pay more than you need to for a Medicare supplement, a Medigap plan, because the benefits are standardized. So if I get a Plan G with Blue Shield, it's the same as a Plan G with United Healthcare or Anthem or HealthNet, Humana. The benefits are standardized. And the choice of providers is the same. Any doctor or hospital that accepts Medicare and agrees to see you can be accessed through any Medicare supplement plan. There's no more specific network, Blue Shield Network, Anthem Network, United Healthcare Network. It's any doctor anywhere in the country who accepts Medicare and agrees to see you. You're not losing out. And the deductible, let's say you've already met your deductible in 2025, which you can do fairly quickly with some office visits or imaging. That deductible is with Medicare. It's not, you're not going to have to meet that again if you've already met your Part B deductible. And with the California birthday rule, there's no hassle at all to moving. It's very simple, no health questions, no underwriting, just move within the birthday rule period. And we do that for our clients all the time. I would say, though, that you mentioned contact your agent. Unfortunately, in this business, Jack, some agents, they want to make an initial sale, but they don't want to deal with the clients in the future. They know if the person goes on a Medigap plan, they're going to be happy with their coverage, but they're not going to shop that plan for a client. Now, we notify our clients every time around their birthday and at different times through the year about the birthday rule, and ask them if they do want to shop their plan.
Okay. Yeah, that sounds great. I know that, have a very high level of service, especially comparatively. I know that you have to run here soon, but I did just want to get your opinion. So, as of right now, with these rate increases and just in general, we've been hearing a lot about the Plan N. Of course, the Plan G is a mainstay. But in your opinion, as of 2025, what's the best option for people? Of course, it depends on a case to case basis, but from your perspective, you work with thousands of people on Medicare, you've helped thousands of people, you've been in this industry for a long time. What do you see as the best overall Medigap plan at this point?
Yeah, like I mentioned, we do have the one carrier that has very competitive Plan F rates. Sometimes people like that, but that's generally not the best value. It's a great plan. It's hassle free. That's what I'll go with in about 18 months when I become eligible for Medicare, because we do have some great carriers that offer a new to Medicare discount. We also need to take into account spousal or household discounts. But I think the Plan N is a very solid choice. We've got some great rates on Plan N. And the Plan N, because it is a Medigap plan, a Medicare Supplement plan, it retains the key benefits that people will want if they get hit with a health problem and they need optimal medical care and they want the freedom to go where they want to go and not have to worry about their healthcare plan. The main advantages of a Medicare supplement plan are that you can access any provider anywhere in the country who accepts original Medicare and agrees to see you. That's over 90% of the doctors in the country, and actually about 99% of major teaching hospitals in the US accept original Medicare. So if something goes wrong and you've got a health crisis you're dealing with, which unfortunately I see a lot in my practice here because we're talking to people about their health and their health care, you can go to UC San Francisco, you can go to Stanford, you can go, like in our area, we have a very good teaching hospital, UC Davis here, but people that want to go to Mayo Clinic, that want to go to MD Anderson or Cleveland Clinic or UCLA to access the cutting edge treatment and the best doctors in the country. So I think for me, that's the number one advantage of Medigap. Number two, I would say, is very predictable out of pocket costs. So Plan F plugs up all the gaps in Medicare medical coverage. Plan G, you have that what I would consider a very small annual deductible, 257, and then the Plan G plugs up the rest of the gaps just like the Plan F. Plan N retains those benefits, so it works like a G. It does add a couple of other copays. So you have up to a $20 office visit copayment with Plan N, and not all doctors are going to bother with that, but you can have up to a $20 office visit copayment on Plan N. You also can have a $50 emergency room copayment, and then Plan N doesn't pay something called excess charges, which are if you go to a doctor who accepts Medicare, but they don't accept Medicare assignment, they can charge up to 15% more than Medicare allows. Now, in my long career in the insurance business over 30 years, I've only seen excess charges applied two or three times. It's very rare because Medicare makes it difficult for the doctor to go through that process of charging the excess charges. It can happen, but it's rare. And then one of the other key benefits I'll touch on just quickly, Jack, before we go, is that with Medigap, as opposed to Medicare Advantage plan, which is a replacement for original Medicare through private insurance companies, the insurance carrier with the Medigap plan has no right to require prior authorization or delay or deny paying for care if Medicare covers it. So they're contractually obligated to follow along. So medical care decisions are between your doctor, they know if Medicare covers it, the Medigap plan must pay their share for that procedure. And that's one of the main benefits of having a Medigap. If you've got something going on, a major deal, the last thing you want to be worrying about is whether or not your insurance company is going to pre-authorize your care, whether you're going to be fighting with your insurance company, and how much you're going to have out of pocket. So those are the reasons I will go with the Medigap plan. And that's why I recommend those for most of our clients. And we work very hard to keep them with competitively priced plans based on all our knowledge about the carriers, the discounts, the gym benefits, and so forth.
Thank you so much for all that, Tim.
Yeah,
It's always good to talk to you. You're a wealth of knowledge. Again, thank you for taking the time to come on because, like you said, this is important. This is money. The sooner we can get people informed about it, the better. I definitely want to talk to you a bit about the gym next time that we're on the
yeah.
podcast. So let's certainly do that. But for now, I know you got to go. So thank you again, and I hope you have a great rest of your day.
You too, Jack. Thank you.